if we can go to the next slide, that would be great. So in terms of our clinical quality registry program, in essence, Victorian Public Health Services contribute data to over 50 registries, both nationally and in the state. And Victoria oversights the Victorian Agency for Health Information oversees the contractual arrangements for 7 registries in the area of cardiac outcomes, cardiac surgery, intensive care, stroke, trauma, and then also rehabilitation and persistent pain. This was an area which was targeted in the Targeting Zero review. It's a very important area, and Professor Duckett very eloquently made the comment that there is much rich information that we can garner from clinical quality registries, and really that's one of the aspirations that we've had over the last couple of years to make that data more widely available, particularly to health service CEOs and boards. And that's where we've worked very closely with our data custodians and also our clinicians in SAFER, in the clinical networks at Safer Care Victoria. Next slide, please. So one of the really exciting developments that we've seen in terms of the clinical quality registry program is a requirement going forward that registries are to share the data with the Victorian Agency for Health Information. And this is when we can use some of the data in our regular routine reporting. Mary spoke about the Board Safety and Quality report. This is produced twice yearly. And you can see here that there are now 13 measures included in that report from 5 of our clinical quality registries that we provide funding to. And you can see that there are a couple of surgical measures that are included, and these are from ANZCATS, covering risk-adjusted mortality rates for CABG, and then also the proportion of CABG requiring reoperation for bleeding. These have been a very popular addition to our board safety and quality reports. A lot of the CEOs and boards don't usually get to see these data, and they were certainly very, very interested, and we're looking to see more reporting in the future. Now, for clinicians that are present, next slide, it's always useful to know how these data are used, how they drive improvements. Certainly there is much evidence to suggest that registries are very important in driving significant quality improvements. And so what I've included here is some data from the ANZCATS registry, and you can see some of the statistics which are reported through that registry and the improvements that have been seen over time, both nationally across New Zealand and obviously in Victoria. So certainly Victoria reports on this measure, but for bleeding in the Board Safety and Quality report. Next slide, please. And what I thought I would do was I would include a screenshot from one of our reports. So clinicians present can see how these data are used in our reports. And what we see here is obviously a de-identified version, and down the left-hand side of the screenshot, you can see the health services which are represented, and they're obviously classified according to their peer groups. And then for this particular measure, you can see the statewide metric in January to June 2020 for the first 6 months. We saw 674 cases reported, of which 1.8% required reoperation for bleeding. And then health services, when they get this report, they can readily compare this metric to what they achieved over the previous 6 months, and they can see what the percentage change is indicating. And obviously at a statewide level, we're not necessarily seeing any worsening, etc. But for some of the hospitals, and we've got a major hospital that's included here, you can see that perhaps there needs to be a bit more closer attention to that particular hospital in terms of driving improvements. Next slide. In terms of patient-reported outcomes, this is a very exciting area, and one which certainly I'm very happy to be involved in, as are the rest of my colleagues. Again, a central recommendation of the Targeting Zero review, and very much a focus on patient-centred care. The recommendation there was very much we should move to the development of statewide collections to measure patient-reported outcomes. And this is where we are working, and in particularly very closely with the Australian Orthopaedic Association on its joint replacement registry. Obviously, the joint replacement registry has been involved for many, many years, but the foray into PROS is more recent. Over the last 18 months, Victoria participated in a pilot to capture PROS measures in approximately 5 or 6 Victorian public health services. And now the collection is being rolled out nationally. And by December 2020, there'll be approximately 23 Victorian hospitals reporting PROS in this collection. And by the end of 2022, there will certainly be many, many more, and we should have complete coverage. Now, this collection uses the EQ5D5L tool and also the Oxford Hip, Knee and Shoulder score, which many surgeons present would be familiar with. And we're looking forward to consulting further with relevant experts in the area and think about how we may use these PROS really to drive improvements going forward in terms of our reporting program. We've done work previously with the FLORI, where particularly focusing on the stroke registry, we really tried to better understand how we can improve the uptake of PROS, which are used by clinicians. And there has been many learnings from this work. And you can see that there are a range of other collections that we are involved in, not only looking at new collections, that's our burns collection with the Burns Registry of Australia and New Zealand, but also working with Movember and the Prostate Cancer Outcomes Registry to think through also how we might encourage uptake of PROS, particularly for patients in terms of their use. Next slide. Now, one of the areas that I did want to focus a little bit more on today is our recent survey, which has been completed in consultation with our cancer area. This is when we saw PROS collected as part of a chemotherapy module. This initiative tested the feasibility of collecting PROS. And it's interesting because it wasn't collected through our CQR collections, but through a top-down approach using a patient experience survey, using the generic EQ5D5L Pro measure. The survey was collected across a 4-month period in 2020 from approximately, just more than 2,500 patients who received chemotherapy treatment in 2019 across 38 Victorian public hospitals. So what you see here is some of the results for PROS, which have been captured for those patients who received additional treatments on top of chemotherapy. So down the left-hand side, you can see the PROS measures that have been captured according to the domains in the PROS instrument, and they're reported for surgery, radiotherapy, and hormonal therapy. And then at the bottom, you can see the mean health rating, which is reported. As part of the survey, each patient is asked to fill out a scale where they rate his or her health from 0 to 100, where 100 is the best imaginable health. So you can see the outcomes are very good for surgery in this survey. And you can see certainly when you look at some of the domains, the mobility, self-care, unusual activities, etc. You can see certainly the PROS results, and the percentages show the patients with whom they're experiencing no issues are high. So this is certainly a very exciting area. This is just a snapshot slide. And if there's interest, certainly I'm happy to come back at some other stage and talk further about this. But this is certainly one of the innovative studies that we're involved in terms of patient-reported outcomes. And we are certainly looking forward to releasing the results of this pilot survey later on down the track. I thought I also might briefly touch on the work that we've been doing in safety and surveillance, looking at the Victorian Health Incident Management System. And if we can just go to the next slide, that would be great. As many as you would know, VHIMS has certainly had a checkered history, been subject to many Auditor General reports. And it's just been fantastic to work in this area since my time at the agency, and just see the tremendous improvements which have come through. So for the first time, we've been able to see statewide reporting of VHIMS data. And the first report was released last year, and we've more recently released a more recent one, which is looking at medication clinical incidents based on 30 months of data to the end of 2019. When we look at medication-related incidents, they are the second highest after falls, and there was a lot of focus and attention on this. And we can see that there are, you know, of all the incidents that were reported over this period, 16% were medication related. The report was launched in November, and we had a live webinar, and it was fantastic to see so many people in attendance. And we had Professor Michael Dooley, who will be familiar to many of you, talking about some of the improvements which can come about from these data. So just quickly, in terms of, next slide please, in terms of some of the findings, what we can see here in this slide is the medical clinical incidents by process type, according to, I guess, the process of how medications get to the patient. And this reports on the incidents which have the highest incident severity rating. Obviously, ISR1 is a severe death, the most serious, or the sentinel event. And from a surgical perspective, that would include an example of such as the development of a surgical site infection, which resulted in death, etc. So fortunately, most of the most severe medication incidents are relatively, they don't occur that frequently, and most are rated as ISR4, which is no harm or near miss. And we know from the analysis that the most serious medication incidents covering ISR1s and 2, most of them are occurring during the prescription stage or the administration and treatment stage. And just for my final slide, this really indicates and is probably of interest to some of the surgeons present, the medications which are most likely to have problems. If we can go to the next slide, please, are the high risk or A-pinch medications. And what we can see here that particularly, you know, 75% of the ISR1 incidents involve these medications. Half were related to the prescription of anticoagulants. And then also when we look at the ISR2 incidents, which are the moderate harm types, again, we can see A-pinch do account for many, with insulin administration being the most common. So that's it for me.